The Human Optimization Podcast is proudly brought to you by Vicon Supplements, where quality meets sustainability. Vicon's all-natural supplements are handcrafted and sustainably produced in Canada, bringing you products that nourish both your well-being and our planet. Visit viconsupplements.com today and be a part of a greener, healthier future.
Are you ready to embark on a journey to the best version of you? Join me, Lisa Pitel-Killah, as I dive deep into the world of hair tissue mineral analysis and functional medicine with fellow experts, and guide you on the path of unlocking your full potential. As a multi-time kettlebell sport world champion, I'm on a mission to reach high-performance professionals from around the world to help you minimize tiring symptoms, maximize health, and gain unstoppable energy. This is the Human Optimization Podcast. Welcome, everybody, to a brand new episode of the Human Optimization Podcast. I am super excited to have a woman on the show today. She is a doctor, a board-certified psychiatric mental health nurse practitioner with a doctorate in nursing. Her name is Dr. Patricia, or goes by Trish, as I learned earlier. Over 25 years of nursing experience, and she noticed the pitfalls of overprescribing medications in mental health care. To offer a more holistic approach, she became a certified functional blood work specialist, which we're going to dive into, focusing on uncovering root causes rather than symptoms alone. Driven by a passion to empower patients, she utilizes personalized supplementation protocols and integrative therapies to address various health imbalances, aiming to unlock vitality and resilience. Amazing work that you're doing, and I want to hear all about it. Now, I always ask all of my guests, because there is a time and a place and a reason that we are here today, and why you obviously are passionate and doing exactly what you're doing. So walk us through your journey and tell us a little bit about what led you here and how you got here.
Oh, absolutely. Well, thank you for having me. I really appreciate it. And I'm really excited to share this information. So I've been a practicing nurse for 25 years. Mm-hmm. And most recently, I became a nurse practitioner for the past 3. Amazing. And that was sort of led me down the path of looking at functional blood work and integrative sort of therapies really came from parents of patients that I worked with. So I specialize in working with children, adolescents, and young adults. Mm-hmm. And they come to me and I, do a workup and an assessment. And I found that parents were asking me, what do you know about alternative or different approaches to help my child's ADHD diagnosis? Mm-hmm. What do you know about anything that's over the counter, any supplements? And I was really taken aback after a while. And I thought, I don't really know a whole lot, because my traditional training in Western, medicine, which is mm-hmm. great, didn't really focus on alternative or integrative approaches. We sort of approach healthcare by reacting, and we don't do a whole lot by being proactive. So once I started, thinking about it, I said, well, why aren't we offering something, especially, to kids, Yep. And I said, I gotta look into this. So I found this online course, and I really delved into learning blood work in a different way than what I had been used to. What I had been used to was these lab ranges that I had to memorize, and I knew what sort of each one of them meant, but we're not trained as nurses to really use them to diagnose. Right. They come up flagged, if they're within normal limits, they don't get addressed or looked at only when they get flagged. And then physicians will use the information to come up with a diagnosis. So once I got certified in functional blood work, I realized, well, just because it's normal doesn't mean we're functioning at the optimal level, because there's a lot of subclinical, ranges there that we can intervene. Mm-hmm. So that we can have a more, integrative approach. So I really looked at this a completely different way and realized that there's a lot more I can do to be proactive and to help my patients now, rather than waiting for those lab values to, fall on either side of the blood range. So I thought that was really wonderful. And it does provide the opportunity to be able to talk about these things with my patients now. And, when they come to me and they've been feeling down and fatigued and really depressed, I like to look at their blood work. And a lot of times I find there can be correlations with how they're feeling mentally because of, something that is deficient, like vitamin B or vitamin D.
Mm-hmm.
And I thought, well, this is a great approach. And this just gives people just an extra opportunity, or an additional tool in the toolbox in order to use. I'm not anti-medication. I think they're wonderful. Medications are life-saving and they do a lot, but I like that we have other things that we can use too. It doesn't just have to be medication. And in traditional prescriber, that's what we do. We prescribe medications, and we're not really so focused on, getting upfront and ahead of needing that. So I found it's really something that I think a lot of people should talk about and really look at, because it can explain definitely a lot of those underlying health concerns that people have, especially when they go to the doctor and they have their physical and they have blood work and everything's normal. Yet they've been experiencing malaise or just fatigue or just something going on, not enough where it's going to just pop up on a blood panel, but definitely there's something going on that's underlying that we can look at and address for sure.
Yeah, that's amazing. And so important when we're talking about being proactive, especially in kids, right? Adolescents, being proactive rather than reactive. What would you say after discovering, the fact that there are I would say, the Western medicine blood ranges, but then the functional ranges? What was the biggest takeaway for you when you discovered that?
I discovered that, with Western blood ranges, the ranges are really, really wide.
Yeah.
So, for example, vitamin D is anywhere between 30 and 100 on, just a regular panel. And that's a big range, where to be optimal, we would like those numbers for vitamin D to be about 80. So there's a huge gap there.
Right.
So that's definitely something that I have found, is that we're not really optimizing the cells. Our body is made up of millions of cells. And when we don't optimize the cells, then they don't function as well. And then it can lead to all other things, because everything is connected. So if we're not really fueling, the foundation, for example, then we can't be too sure that the foundation is secure.
Exactly.
Yeah.
Yeah. No, very true. And I find it interesting too. It's one of those things that ends up sometimes being overlooked. And it's really comes down to the importance of the micronutrients, not only what we're getting from our food, but as you mentioned, with supplementation, right? These can, the value of these, the level of these in the body can have such a huge effect on how the body is operating, right, at that deeper level, and how it's repairing. And so what would you say, like, I would think now, but I'm going to ask the question just with regards to maybe the demographic you're dealing with before you came across this, what would you say, just based on the change and that pivot, if you will, from a Western range to a functional range and trying to optimize things? Do you write now like less prescriptions now based on what you're that change?
Yes, I'm not as quick to prescribe. I have been finding, since I've been delving a lot more into blood work, that the vitamin D deficiencies really have, I shouldn't say, I mean, I shouldn't be surprised that they're so deficient, because we don't get a whole lot of sun, depending on the climate and the area that you live on.
Right.
I think also there's this like fear of the sun. You can't be outside without any sunscreen, and really exposure to sunlight, natural sunlight for 15 minutes a day is the best way to get that vitamin D. And when we're told like the sun is bad, that can contribute to lots of deficiencies in vitamin D, especially we're told in the winter, put on, sunscreen and all of that. So we're really minimizing how much exposure to the sun that we should be getting because, of what we're told about the dangers, which of course there are, but that's been one of the biggest things that I've seen is patients will feel really down, depressed. They're exhausted. No matter how much sleep they get, they still wake up feeling exhausted. And I look at their vitamin D, and 95% of the time they're low. Not even within like the normal Western low, but they're like, I had one that came back at a 12, another one was a 20, and these require prescription vitamin D and to get that up. But there's, the blood work has so many hidden gems and so many pieces of information. If we just knew how to look at it a little bit differently, then it can make all the difference in how we go forward.
Absolutely. And so what would you say, since we're talking about blood labs, we're talking about being proactive, and, we talked about vitamin D a little bit, even with regards to deficiency, what, exploring the impact that vitamin deficiencies, have on somebody's mood, how they react, expand on that and tell us about that.
Yeah, absolutely. So with our mood, we have two neurotransmitters that are technically the happy neurotransmitters, and that's serotonin and dopamine. And another interesting thing that people probably don't know about is if someone is coming in and they're feeling depressed and they're feeling, not right, they might have some gut issues because serotonin is produced in the gut. And some people don't realize, well, could my depression be linked to something that's going on in my gut? Maybe I have leaky gut, or maybe I have an underlying infection and I've had, GI symptoms, maybe a little bloating here and there or constipation, but it could be, was it something I ate? Was it, and you've tried to eliminate all of these things in your diet, but that's definitely one thing that has a direct impact on your mood that could be deficient. Medications, what we do for improving depression is we increase the levels of serotonin that's available. And if we're not looking at the gut first, we could be missing that important piece, right? So if we don't address maybe the gut issues and our gut somehow is inflamed and it's not absorbing the nutrients, or the permeability is, not as strong as it could be, then that can lead to us not being able to produce the serotonin, which will have a direct impact on our mood. So that's just another thing that you're like, I never really thought to automatically look at somebody's gut first when they, when they have these like brain symptoms. So
and that gut brain connection is really strong, and
it is.
I do think that people don't really understand that maybe as well as they should. And I feel like as well, and you can expand on this too, but I feel like, and this isn't anything new, it's not a revelation or anything like that, but I feel like people become used to symptoms, right? It's like, oh, it doesn't, every time I eat, I get a little bit of gas, or every time I have, this, I get a little bit of, loose stool. They don't change anything, but now it's become part of the common practice of their day, right? And this really isn't a good place to be sitting in.
Correct.
Yeah. So share a little more too, just with regards, like, what are some of the things in the GI? I mean, we talked a little bit about symptoms with regards to like bloating and obviously things like that, but just things that can be going on that really do have a bit of a disconnect and can affect obviously your brain and your mood and how you deal with situations, etc.
Yeah, one of the main things that could be going on in the gut is we could be dealing with an underlying infection of some kind, whether it's a bacterial or a viral or a parasitic infection. And this in particular, when you mentioned before, like, oh, I always have bloating whenever I eat
Hmm.
this or whenever I have that. And what we find is that when people are eliminating things from their diet, and they are still experiencing some of these symptoms, we could, there could be an underlying parasitic infection that is going on there.
Right.
So if the, gut doesn't have the good probiotics and all of the good things that it needs in order to stay healthy, well, what ends up happening is the bacteria ends up multiplying, and that's going to lead to us not being able to absorb nutrients
Hmm.
from foods. The GI tract is not going to be able to use those important vitamins to fuel the rest of the system,
Yeah.
right? And it can lead to, again, mood disorders. It can lead to a decrease in our immune function. It can lead to brain fog, all sorts of issues that, like you mentioned, people just kind of brush them off and,
Right.
oh, that's not really a thing, or that's okay, I'll just like move on. But we really, need to make sure that we have a good balance of the bacteria, because it's also going to help with our immune system, and it's going to help us fight off other things as well.
Absolutely.
Yeah.
Absolutely. What are some of your favorite, when we talk about the GI, we talk about like probiotics, prebiotics, right? Feeding that good gut bacteria that we do have, that again might not be in the best balanced place, at the moment. What are some of your favorite things to bring in to be able to help support that?
Well, things like making sure that we have whole grains, fruits and vegetables, really limiting processed foods,
Hmm.
trying to eliminate artificial sugars, dyes, things like that.
Yeah.
And then feeding the gut fermented foods. So things like kimchi and things that are pickled, and all of those have good, healthy probiotics in them. So if we get in the habit of just having, some fermented foods,
Mhm.
that can definitely bring in some of those good probiotics, and taking some, probiotics as well. But I think really looking at our diet, because I
Yeah.
think over time, a lot of the chemicals and the things that are processed and the foods that make it so convenient because we're all so busy
Yeah.
have also sort of wreaked havoc on the way our GI, has evolved over thousands of years and has become not as efficient as it once was.
Yeah, I agree. Well, and I find it interesting too because again, there's so many starts of problems that can happen in the gut, right? And I feel like kind of I always say the gut's a little bit like an onion, and this is not my a creative saying. I've heard it somewhere. Gut's like an onion, right? You peel off one layer and then something else kind of pops up. And that can be true for many different things. And I feel like the interesting part is too, I feel like the more that someone has symptoms that they ignore, the more that their body ends up suffering because of it, right? We have to think about the fact that if we have a negative reaction to something that we're eating in our GI, we're having a symptom, the more that we continue to do the same thing, the more inflamed we are,
True.
right? And all this inflammation creates an environment that is really hard for the body to be able to thrive, right?
Absolutely.
Yeah.
Absolutely. Yeah.
And I want to talk a little bit about too, because we're talking about mood, we're talking about that gut brain connection, talking about anxiety, right? Anxiety, I feel like in today's day and age, social media, what we've been through just with regards to, the past few years, there's a lot of anxiety. How does that tie in to kind of what you're experiencing with the demographic that you work with, and even with regards to some blood markers that might be able to identify contributors to that condition?
Yeah. The our gut actually, funnily enough, is also referred to as our second brain because of the strong connection that, the gut and brain do have. I mean, just think about it. If you get nervous, some people end up with diarrhea, or
Yep.
they have a stomach ache because they're so nervous. So it
Mhm.
definitely has a direct, connection to it. And then what people don't realize is that over time, the gut brain, this can influence not only anxiety, but things like metabolism,
Mm.
um, pain sensitivity, digestion, cognitive function,
Yeah.
or hormones, so we could see, definitely an increase in anxiety in that it could just go across the board.
Right.
Because our digestion, again, with the absorption, with the nutrients, the mood, with the serotonin, the pain sensitivity, the cognition, just really all of those things. Definitely, I've seen an increase in anxiety too,
Mhm.
um, with that. Um, and some of the, markers that I look at is, I ask them how they're doing with their GI. If there's any abdominal complaints, many times they always say, a lot of them will say, oh, my GI, I've always had GI, symptoms, or I'm gluten-free, or I always find that patients are trying to manage their anxiety by changing sort of their diet and what they're doing about their GI stuff. And I find
Right.
sometimes like, ooh, was the GI stuff there first that caused the anxiety? It could have been,
Mhm. Yeah.
so I always find that very, very interesting that a lot of the patients who have the anxiety disorders also complain of GI symptoms and like
Yeah.
just vague things. A lot of them are following up with GI, and I've had all of these things, and I can't figure out what's going on, and everything is normal, yet I always have a stomach ache, or
Yeah. Yeah, that
yeah.
is really interesting. And do you see a difference between, again, just I feel like in this day and age, we're hearing a lot more about younger generations having, pretty severe anxiety. Do you
Yeah,
find that you're seeing it in younger and younger patients now?
absolutely.
Yeah.
Um, I think COVID had a lot to do with that
Mhm.
when kids were, kids that were already anxious and
Yeah.
depressed were told to isolate and to stay away from friends and not interact.
Yeah.
And definitely, we're seeing the effects of that, that it definitely has caused an increase in anxiety. I still hear that today. My child was doing great, and as soon as COVID hit, they became much more anxious. They don't want to go back to school. That's another one that I found, is that kids
Wow.
didn't want to return to in-person learning because they were home, and
Right.
then it just made it that much more difficult to get out and go back into the routine of being social and being around other kids. So it
Yeah.
definitely had a lot of effects on kids, and anxiety definitely being one of them.
Yeah. And what would you say, just for a couple of, I guess, kind of at home tactics, if someone has a child with anxiety and kind of struggling with that, what are some of the steps that might be able, just simple things that they might be able to do to help them? Is there anything generic that you would recommend?
Yeah, usually something like deep breathing,
Yeah.
just closing our eyes, taking a couple of deep breaths, reassuring. You know, I like things like Headspace, or
Mm.
like relaxing music.
Yeah.
Um, Having kids journal, is another one that I think, and these are all things that parents can do with their kids if they're feeling super anxious, but just simple things. Let's take a breath, let's go for a walk outside, let's sit down and write what your anxious thoughts are,
Hmm.
things like that, very, very simple, that can be done at home to kind of help, and teach kids too. It's okay to feel a little nervous, it's not all bad, but when the nervousness or when our worried thoughts sort of get in the way of us enjoying our life and being able to do things, then, those are things that, we'd have to do a little bit more about. But I think just teaching kids that it's okay, and to just take a step back and take some space and distract,
Hmm.
and just kind of let them come hopefully back down on their own is great. But definitely we don't want to have kids isolating and refusing to do the things that they enjoyed doing before. So yeah, those are the things that we'd want to watch out for that may require a little bit more of an intervention.
Got it. Got it. I find it so interesting too, because, when we think about not even just anxiety, and we're talking about a certain demographic, but just in general, when we think about stress, and I always talk about journaling, it's so helpful to be able to kind of, dump that out of your mind and onto a piece of paper. And, you think back to when, 40, 50 years ago when we were kids, and it's like we all had a diary. Right?
Yes.
We were journaling without even realizing what we were doing because we were writing in our diary,
Yeah.
whatever that was. If
Yeah.
it was a bad day, a good day, something we were dreaming about, you wrote it in your diary, right? And I just feel like over the years that the diary kind of fell to the wayside. Nobody did that anymore, right?
No,
And
it's
now
true.
we're bringing it back into the picture and just calling it something a bit different.
It's true. When I worked at an inpatient unit on a children's unit in the hospital. And every night the children were expected to write in their journal. They had 20 or 30 minutes of journaling time before going to bed. And it
Yep.
was an expectation that they did that. And it's great for a lot of reasons. Process feelings, write down things, maybe they can't express what they're feeling.
Yep.
But journaling was one of the things that on the inpatient unit, the patients there were required to do, and it's very helpful. I mean, adults should be doing it, and you're right. I forgot that back then when I grew up, everyone had a diary, and we just
Right?
sort of like the
Yep.
diary's been replaced, I think, with phones and screens. But
Yeah.
yeah, that is just a simple thing that anybody can do, especially kids.
Yeah. Yeah. I
Write down
agree.
what you're feeling and
Well, and you made a really good point too. Sometimes we don't know how to say it out loud of how we're feeling, right? Especially at a young age, we're learning and we're dealing with new feelings, right? So just being able to write it down where it's just you, again, kind of unloading the mind, it really is a healthy way to be able to even look back as we read
yeah.
back and go, oh wow, now I understand what that means, right? Then I didn't, but now it's kind of coming together, and you revisit it and learn from it. I find, yeah, it's really interesting exercise. So yeah, amazing. We forget about all these things, right?
We do. And yeah, we try to overcomplicate it. But if we just like get back to the
Yeah.
basics and simple things like fresh air, good, healthy food, water and
Yep.
journaling and taking 5 minutes to just deep breathe and meditate, that's huge.
Absolutely.
And I'm guilty of not engaging in a whole lot of them myself. But yeah, it
Yeah.
is just, it's down to the basics.
Yeah, we get down those rabbit holes, don't we? You know
We
what I
do.
love though? I love when you say, deep breathing for 5 minutes. Because I think a lot of times, I mean, kids specifically, but adults as well, we think meditation, well, I can't do that. Or I don't have, what's the biggest complaint? I don't have time to do that.
Mhm.
Right? Whereas all you need to, like, if you are in a position where you're feeling anxious or upset or angry, if you turn around in your chair and take even 5 deep breaths with your eyes closed, and then you turn back around again, you're literally going to feel like a different person, right? You've
Yes.
changed that energy. And that's very helpful just to be able to do. And really, there's no excuses for that one. Anybody can
Yeah.
do that,
Yeah,
right?
it's doable. It's
Yeah.
doable. Yeah, and I like that because the meditation I've tried, and I find like sometimes, oh, I should be doing this. You almost feel a little bit guilty because you're like, I should actually, what should I be doing right now?
Yeah.
But I think if you just take the deep breathing, just 5 minutes,
Mhm.
anybody can fit in 5 minutes, and that's
Yep.
great. It feels a lot less than, it's not as overwhelming as I'm supposed to sit here and meditate for 15 minutes or however it is.
Yeah.
That's overwhelming.
I
And
agree. Yeah, I agree 100%. Amazing. Well, thank you for sharing. And again, for those of you watching, listening, just again, remember, if you've got GI symptoms, if you've got, moods that's attached to that, like, don't ignore them, right? This is important information. Your body is trying to communicate with you when something isn't quite right. And don't ignore that because, there's a message there and sometimes we're not listening. And so tell us how, and so the demographic, obviously you work with, you shared adolescents, young children. If somebody is listening or watching that has, a child that has issues, how do they find you and how do they work with you? Tell us some background on that.
Yeah, so I actually have two ways of working with people. So one of them is with my integrative psychiatry. So people can find me at wholehealthpsychiatry.net.
Okay.
And I also can work with people of all ages because my functional blood work role, I am able to provide people with reviewing their blood work. I can order blood
Amazing.
work for people if they don't have, labs or current labs, analyze their blood work. They can book a one-on-one call with me where we can review what I found in the blood work. And then I have these programs that I can help people just sort of reset their whole microbiome, look into maybe eliminating those underlying infections and all of that. And if people are interested, I do live workshops. I do one a month where I invite people, come on, bring your blood work. Let me teach you what's going on here.
Yeah.
And for information on that, it would be wholehealthalternatives.com. And that's my functional blood work business, and I can work with people of all ages. And I hope that people, find me and I can teach more people how to look at their blood work in a new way. And we can hopefully address some of those health concerns that maybe they've been experiencing, but they're told that everything looks normal.
We've all been down that road. Everything looks quote unquote normal, right? It's like, then why don't I feel normal?
Right.
Right? Yeah, absolutely. Okay. So, well, thank you for sharing that. We will have all of Trisha's links in the description. So just make sure that you look there and we'll have direct links to websites and how to find her and how to work with her. And so again, I just want to thank you for coming on and being with us today and sharing that information, such critical information, especially as we move forward. And again, after the years that we've experienced and some of the challenges with that, it's really important to really consider these things and think about the proactivity rather than the reactivity.
Yeah. Well, thank you so much for having me. It was a pleasure.
Absolutely. Well, thank you. And so for those of you watching, make sure you subscribe to my channel. We have a brand new episode every 2 weeks. Make sure you give this episode a thumbs up. And for those of you listening on your favorite podcast host, make sure you give this episode a like, and I will see you next time. Thanks for joining us today on the Human Optimization Podcast. Episode technical production is by Grace Sylvester and guest booking by Stu Tate. Want to learn more? Visit Pitel-Killah.com for incredible free resources to supercharge your journey to becoming the best version of you. If you enjoyed this podcast, please like and subscribe to the Human Optimization Podcast and follow me on social media at Pitel-Killah.